And as we mentioned earlier, Hochul is proposing a new package of criminal justice reforms. We'll see where that ends up. But turning now to health care in the state budget, Democrats in both the state Senate and the Assembly want to create a new public health care option this year for low-income undocumented immigrants in New York. The idea would be to give them access to the state's essential plan, a public health care option for low-income people. Assembly Speaker Carl Heastie said this week it's going to be a top priority during budget talks.
If people are going to get sick, they have to be taken care of, and so it's an expense that the hospitals would bear anyway. So I think it's very important that one lesson we learned throughout this pandemic is make sure that people are healthy, and so it's very important to us.
Supporters say it would bridge a health care gap for undocumented people who can't get Medicaid. For more on that, I spoke with Murad Awauda, Executive Director of the New York Immigration Coalition. Murad, thank you so much for being here. I appreciate it.
Thank you for having me.
Of course, anytime. So this bill would essentially create a public option for low-income undocumented people to get health insurance. First, I want to get some context from you. So do we know in New York what share of the undocumented community is living without health insurance right now?
There are tens of thousands of New Yorkers who currently do not have health insurance. And as we're living through the global pandemic, we've seen the impacts of those who have not had healthcare options or the opportunity to get the healthcare that they needed to be able to not just survive in the state, but to thrive. So we're working really diligently right now to make sure that Coverage for All becomes a reality this year in the upcoming budget, so that tens of thousands of essential workers, folks that we were clapping for at 7 p.m. every night over the past 2 years, have the opportunity to get the care that they need.
So I know that if I didn't have health insurance, I would never go to the doctor because of the cost. And I'm wondering, for these undocumented people that don't have health insurance, is that the case? Are they foregoing care, or are they seeking out care but just can't afford it?
I think it's a little bit of both, right? Folks, if you are in desperate need of care, you're going to end up at the emergency room. And people also can't afford paying doctor's visits, can't afford paying for medication, which is why Coverage for All is so essential in this moment. We really need to make sure that this year, Governor Hochul and our state legislative leaders ensure that they deliver for a third of New York State's essential workers and 50% of New York City's essential workers who fought to keep our state running during the pandemic and continued to keep our economy going, right? So in this moment, this is the moment that we need to be able to deliver for everyone in the state of New York to have quality health care.
So this bill would provide a public health care option to undocumented people who make up to 200% of the federal poverty level. I'm wondering, what do you do about the people who don't have pay stubs and W-2s to prove that they could be income eligible for this plan? How do you address those people?
Well, there's a number of different ways to do that. Folks have the ability to prove their income through bank statements, through letters from employment. Their 1099s when they're self-employed and they're contractors. There's a number of different ways that folks improve their income eligibility.
So I imagine opponents of the bill would point to the cost. I believe it's estimated to be about $500 million. Correct me if I'm wrong. And I imagine the opponents of the bill would point to that undocumented people don't pay the same amount in taxes as people who are here, native-born citizens. How do you address that concern from people who might say, well, where do we get the money to pay for this?
Well, thankfully, the state has over $10 billion billions with a B, in surplus this year. And I believe that the state will continue to have a surplus moving forward into the future years. I think that the question isn't how do we pay for this? I think the question is the New York State budget is a moral document that illustrates our values. And do we want our values in our New York State budget to illustrate us leaving people out, or us actually taking care of people who took care of our economy, our families, cooked us meals, made sure that our fruits and vegetables were picked and harvested? So I think that the question isn't, is it too much? how do you quantify a life in dollars? And the actual cost, which has been updated recently, is 345 million, and 345 million would cover tens of thousands of New Yorkers to be able to have access for health insurance, right? That's what it comes down to. For you to get care, you need the health insurance. And we have support from Buffalo to Rochester, all the way down to the East End, Long Island. And this isn't, a one house issue. This isn't a one, elected official issue. We have an enormous amount of support across the state in our communities as well as with our elected officials.
All right, it's something to watch as we continue talking about this year's state budget. Murad Awauda from the New York Immigration Coalition, thank you so much.
Thank you.